So we are heading up to quarantine right now. We have a draft horse that came in through the auction last week, and its eye is in pretty rough shape. So we are going to be enucleating that eye today, and I believe it's the first surgery that we're doing in our treatment room of the vet barn. So this is pretty exciting stuff. I just hope the horse is easy to catch this morning, but we're about to find out. Just checking to make sure nobody's down. We did have a couple draft horses down over the weekend. So I want to make sure everybody is up and healthy. Oh, buddy. That eye definitely looks a little worse. You're getting in the way, sir. This horse at the auction was pretty worried about me getting up and touching it. But as soon as I got my hands on it, it kind of relaxed a little bit. You may have noticed that the horse that I grabbed had a red tag on it. The red tag means that we believe that the horse is in a critical condition and that it needs to be looked at first when we get it back to the rescue. It's just an easier way to identify what we have coming back to the shelter for intake. Hey, buddy. You're okay, I promise. Great job! All right, we got him down. The vet team is getting ready to do the surgery, so he's just gonna hang out there for the time being until he's ready to go.
We had a Christmas party in our surgery room, and then they didn't clean their stuff up, so now I gotta kick it all out.
You have these tables out too, right? Thank you. I had plenty of time for that.
It smells very nice. I'm sorry to rush you guys. This morning we are about to do one of our very first standing surgical procedures in the new large animal surgery room. We've got a very large draft horse who needs his eye removed. Unfortunately, the eye is very badly infected and swollen, and so I'm anticipating that we might need some longer surgical time. So we're gonna try to accomplish that with intravenous anesthesia instead of general anesthesia, which means he'll be awake and standing on his feet the whole time. We're gonna use some local nerve blocks to make sure that he can't feel it, but there's gonna be a lot of experimentation. He is a very large animal, and unfortunately he's been painful for a really long time, so I'm excited to get this eye taken care of. And we wouldn't have been able to do this surgery standing without the ability to be inside this room and with these amazing stocks. So we're really, really grateful that we have the new hospital capability, because it's allowing us to do more than we would have been able to otherwise.
Good work.
Oh my gosh.
Good work.
Good boy.
There we go.
Good boy. Hi, I'm right back here, okay? I'm gonna touch you. Good boy, good boy. I'm gonna close the stocks. Can you guys smell it?
Yes.
Let's give the Banamine. So this is graphic. I don't know if we can show it or not. I'm gonna touch you. He can't see over here at all. You can see his globe has ruptured and become really severely infected. It's draining mucopurulent discharge, and it's creating pressure inside the socket. Whether or not it's a primary or a secondary growth, it's pressing into his eye socket. So we're gonna have to remove a lot more than we would sometimes to get this under control.
This is Banamine. It's a pain reliever and anti-inflammatory.
The IV catheter is an important part of this procedure because we're doing this all under standing sedation. We're probably going to have to continue to give small amounts of sedatives kind of as we go. So we need to make sure that we have really easy access. She's just double checking that that catheter is going to work. A ruptured and very infected eyeball, and you can see the pressure on this lower lid. There's a lot more pressure back behind, so this poor horse has been really, really painful and infected. Sometimes we kiss our patients. It should be okay to tip back and forth just a little bit. Look how cute his lips are, you guys. Sometimes it's not appropriate to mess with anesthetized patients, and other times it's like the best thing ever. So you can see he's got nasal drainage. This smells, you can't smell it. It smells terrible because that infection is so advanced in that eye. Oh my goodness, he's so cute. One of the things that we're gonna do today is a retrobulbar block, which involves a 3.5 inch long curved needle that's gonna slide over the eye but inside the socket and block the nerves in the back of the eye. So that's a fun one.
The one that you can put in a cup and run it in the cup.
Yeah, so I'm trying to envision and match the curvature of the eye because we don't wanna, the eye is already ruptured, right? But we don't wanna hit any of the vessels or nerves or anything that are in the eye itself. And we're just gonna put that in our wet pack so it's ready to go. So we are putting local lidocaine around these lids. Our goal is for him to not feel anything that I'm doing surgically so that he's really comfortable. I'm happy with that.
Okay. Oh, it looks so sad. Buddy.
Okay, feeding nicely. Can you go ahead and inject? Like about 3 cc's. So I'm getting pressure, which should mean that I'm directly on top of the branch of vessels and nerves that runs with the optic nerve. So we're gonna bathe the back of the eye in lidocaine, which should give us about 30 minutes of no feeling in the back of the eye. I am suturing the eyelids closed. We are gonna use the eyelids themselves to create a little pocket to remove all of that infected tissue in one go. So we have successfully blocked this eye. We have a good plane of anesthesia. We've surgically clipped and cleaned and prepped and sutured the lids closed. So essentially the infected area is contained inside the globe of the eye. And so now we're making incisions just parallel to the lids above the lashes so that we can cut around our surgical area. And then the next step, we're gonna take blunt instruments. So the opposite of sharp, we're gonna take things that aren't really sharp and pointy, and we're gonna gently create space in the tissue around the fat of the eye so that we can remove the whole globe. And from here on out, most of the rest of this surgery is by feel because we can't see back behind that eye. So I like to take things pretty slow and gentle. We want to just make sure that we're kind of feeling our way through. And this is exactly what we want to see. Our patient is stable and on his feet and relatively comfortable.
Anything else out of this pack? So this is a sterile pack, so the outside is not sterile, but the inside is completely, so we had to do sterile gloves. We only needed one instrument. We will be using this pack later. So I just needed to sterilely open it, get her instrument, and then close it back up so we can use it this afternoon on some spays.
So we're transecting some ligaments and some soft tissue, and then just kind of a lot of fat in here. I am connecting the incisions we made on the upper and lower lid
Down.
so that we have an incision 365 degrees around the eye, And then we're gonna start to gently rotate it as we pull, and we're gonna remove the whole thing. You guys, this is so fun for me. I'm having so much fun. I love surgery so much. Okay, so right here we can see that this infection has like punctured the back of the eye, which I kind of was anticipating. So we gotta be really careful not to cut into that stuff. Casey, can you grab some OTT PDS for me? And I'll need the needle drivers too.
And another Epsom brown.
Yes, would love some new forceps. So I'm gonna try to see if I can snag it and close it so that we don't have the really nasty infection that's in this eye pour out into the back of the head. This horse is gonna stay on some antibiotics for sure afterwards regardless. But closing that hole is gonna help. So you can see he's kind of like chewing and blinking, and those are all indications that our anesthesia was getting a little bit light. So we are redosing a little bit. We have confirmed 100% that this was indeed a ruptured globe. So the eye ruptured. We're almost there, team. You got that hot suture ready to go?
Yes, ma'am.
Okay. We're gonna be ready for it.
Look at that.
Clarence, your breath is very hot.
We did get the full eye. Yay! Super happy with that.
You got the whole eye?
We did.
You want to flush in there first?
Yes, that would be lovely.
I am just flushing out this space, getting all the debris and clots from surgery.
This horse is gonna be so much more comfortable without a giant infected eyeball in his head. It went
Like
great.
a murder scene over there.
I am not the world's fastest surgeon, but I'm really, really happy that he stayed comfortable the whole time. Everybody was safe. We did have to repeat anesthesia a couple times, but anesthesia went really well. Our local nerve blocks worked really well. We almost didn't have any hemorrhage, which is hard to believe, but this is a pretty vascular part of the body. We didn't have any major bleeding, so really, really happy with it. I think he's gonna do great afterwards. The thing that I was the most concerned about was the eye rupturing before we got it out and having all that pus fall into the cavity, and we didn't have that happen. So that was great.
What is happening?
Hey, so we didn't get any of that. So we'll come see you once our surgery's done.
Heard that.
Yeah, I heard that. Everything went great. We're about to close. We didn't have any hemorrhage. We were able to get all of the infected tissue out, and he's just gonna have some sutures and hopefully do great. Very proud of him. So excited. I'm super proud of our technicians. Definitely could not have done this without both of their wonderful help. So we're gonna do a subcuticular closure, which is the tissue underneath the skin. We're gonna close in 2 layers. We're gonna go up underneath here and try to eliminate a little bit of the dead space and get the skin really nicely lined up. I don't think he had cancer. And even if he did, we got all of it, so.
I think it was awesome. I mean, this is a newer technique that I haven't seen, and I think that it was really successful and it looks beautiful. So we'll see how it heals.
I'm gonna go scrub my arms off and change my shirt. So we have a lot of other patients to see today.
I think it went good. Now we just need him to wake up.
So we're all finished with the enucleation. It went really well. We just gave him some antibiotics that'll last a couple days, and we'll hop him in the vet barn so we can keep a close eye on him and check out his incision daily.
Well, I dug a ditch last week, maybe the week before, I can't remember now. Because we had really bad water coming up and over the culverts and flooding the driveway, so I dug this new trench to kind of let it go out further and nicer. So now that we got a lot of rain, I get to go back and check it and see how well it's flowing and do a little minor adjusting here and there. And so that's what I'm doing today. Since we got so much rain this morning, we flooded out, and it's working pretty good. There's just little spots that I need to fix.
So what made you start putting up these signs?
It's really slippery here, and somebody nearly fell, or fell, I'm not sure. I wasn't here to witness it, but better safe than sorry, so we're putting up signs. Back to the office.
We're gonna go put her in the dryer because I mean, she needs to dry off. So
Yeah, like I have. Because right now everything's just soaked. So there's a nice little river that runs through the pastures that goes up to like hip level. I didn't realize it until I stepped in it, and then my boots flooded.
cool.
It's great.
No, but my boots, like, they're not like boots because I can't stand like high-heeled boots. They like come up to here, and actually I stayed dry until like the last 5 minutes, and then I stepped into a puddle that was a little too deep. So they're waterproof, so the water stays inside once it gets inside. I don't know if you can get the right angle with the lighting here. Yeah, there's water in there. You don't know me before Jason yells at me.
And we got some food over there if you need it.
We got a whole big bag of food.
I just heard Angela say she might adopt this little dog.
Keith says no.
Hi, baby. How are you?
What do you think, Keith?
I said no, but I think I lost the battle.
I don't think you minded if I change your name to something new. Would you think it childish if I changed my name?
All right, little Miss Shag, you gonna get you a bath? Yes? Oh, thank you. No, thank you.
Start running.
And then...
You're gonna feel much better.
And then... Right, it's all right. Shh, it's okay. It's been a day, hasn't it? Going from all them little mats to getting a whole bath. Look at you. Look at this. Look at her back and stuff back here. It's. Look at you. Look at this. Look at her back and stuff back here. It's. Oh my. What do you think? What do you think, huh? Jojo baby. Oh, it's gonna feel so much better. Gonna be so much better when you're all done, huh? Is that better? Oh. No. Well, Shag has had quite the day. She has been through the vet team and gotten all the mats off of her, and she has gotten her blood work done. I believe she's had all of her vaccines and her microchip, and she has been bathed and brushed, and she's still a little chilly because we just got done bathing her, but she looks so pretty. Look at that pretty hair she's got there, and she's just so pretty. So Shag is all happy now. She's doing so much better. She still has a little bit of stuff we have to do. We have to check her teeth and clean out her ears a little bit more, but she's a happy little doggy today.
Hi, sweetheart.
But I mean, if she's gonna be outside and be a protector, it might not.
Hi.
She does like to jump. She's
Yeah.
so sweet, though.
We'll see if you get along. I'm sure you'll get along. Rowdy gets along with everybody.
She hasn't had any problems with any other dogs.
Rowdy and Covey get along with everybody. And they're with the goats 24/7. Yes, they are. Yeah, so you'll have new friends. Yeah. You're a sweetheart. Yes, you are.
All right, let's go. I know it's raining. He's like, I don't like the rain.
Yeah, mine won't come out either. They're like, no, thank you.
She's so loving. Like I said, she's kind of like, eh. But he's like, no, I must be with her.
Huh? You can come home? Yeah, you can come home with me? Yeah? Okay. Okay. Yeah, you smelling goats. I took the baby goats to get their picture with Santa.
Aww. I love that. Can you get up there? You need some help?
Maybe.
Do you need a slip lead or anything?
I'm too short to reach any higher. My name is Sandra Meaner, and I adopted Butter and Gimpy, the little goat. It was awesome. You guys are great. We've adopted from you guys before. We love dealing with you. Well, we have other goats, and I am going to, we are just starting to sell goat soaps and lotions and stuff like that, and we are going to make Gimpy our mascot. So he's going to be on all our labels, and because he's just too cute.
So we're switching gears. We finished up with horse surgeries. We did some equine physical exams this morning, and now we're gonna swap over and do some dog surgeries.
We are going to place a catheter so that we can have direct access because she is going to be getting spayed today.
We are getting ready to intubate this girl.
Wow, I literally need a surgical light.
Her respiratory rate is like...
Yep, she's out though. She has no puppy, bro.
We do really need a surgical light.
Yeah. It's like 9-day difference.
So I am using a surgical implement to hook one horn of the uterus. It's gonna be little tiny in my little tiny puppy patient. We just finished up a dog spay. Everything went great. Our patient is waking up, and we're troubleshooting our tattoo protocol to ensure that if this patient ends up somewhere else, somebody can make sure that they know that she's been spayed without having to reopen the abdomen.
We just love our oxygen so much. She's not on oxygen anymore.
Just the air. She doesn't want to take her tube out. Oh my goodness. You're not even opening your eyes. You're just not opening your eyes. You're doing so good, Brownie. So we just got done with the spay. It went awesome. Super smooth spay. Dr. Lydia did great. And she is in recovery now, singing the song of her people.
Hey, girl. Here, you just, hey, let's just lay down. There we go. Here. Just sleep.
He's looking at Alfie. I promise he was clean at the beginning of this, then he was wet and he rolled.
Yeah?
That's the first time.
Why is that? How's he with other horses?
He does great. He is like middleman on the totem pole. Unfortunately, right now he's in a pasture with a bunch of boss mares, so we can't really
A
tell.
little bossy. The other ones are pushing him around a little. As big as he is, he doesn't.
Yeah, he was in there with the pony, and the pony is the head of the herd, and
Right.
she's like 28.
Right?
Yeah.
Old pony.
Crippled, arthritis.
But still the boss.
Mm-hmm.
Yeah.
What is it, Goober?
So what you think about him? You want him? I wasn't asking your
No.
opinion, I was asking his.
That was it.
Sorry.
You definitely need personal space training.
He has none. They are adopting Alfie.
Can we back up and not say daddy?
He is adopting Alfie, so sorry. You have to move your new child's picture over to the Found Love wall for this month. He is, yep. So you move him over to the Found Love wall this month.
That's what I'm gonna start calling you right there.
So Gimpy was a three-legged goat that we had. So his name fit him very well.
What do those movie stars get years later? Residuals or something? Come on.
Good boy.
Good boy.
My name's Brian King, and I'm here adopting Alfie. Well, my friend Dwight, he had been here and adopted a horse. He had really good results, and then my kids came out for the homeschool fair, and they told me about that, so that was pretty cool, and I watched that video, so it was really neat. Get him rideable. He's a big horse. He's a little spoiled, but I think he's going to come along well. He's got a good personality. He's going to be a good horse.
So Alfie just got adopted and he's going to his new forever home.
We got a phone call saying that this lady, she just couldn't take care of the horses no more. And so they called here. We're trying to figure out how to get to them, and I said, I'll go pick them up. So I left this morning, headed out towards her house, and loaded up 2 horses, a mule, and a donkey.
Was it easy?
The horses were easy. The mule and the donkey, not so much. I got smushed in my trailer, stepped on, almost kicked. You know, all the fun stuff, It's all good, it's all good.
Good job.
I'm still in one piece, I think. I haven't checked to make sure, but.
That's a big donkey.
Oh, yep, I know.
It's a donkey that had hoof care. Oh, that makes the story even sadder.
Can you get off the lead rope thing? I don't even know what this is. Hold on. We're getting there. Hold on. We're getting there.
The donkey said I'm actually leaving.
Okay, hold on. We're coming. Hold on. This thing just keeps going. Woo! All right. Mr. Mule, or Mrs. Mule, I'm sorry. Miss Mule. This one has no manners whatsoever.
Wow, I'm truly shocked at the no manners. Excuse me, hey. This is a female, right?
That's a male.
Is it a gelding?
Yes, that's a gelding. And this is a female, and those two are females.
Okay.
According to her.
So this is actually a pretty sad situation. This lady was in a domestic abuse situation, and she had to get out of her house to be safe, and she wanted to ensure her animals were safe. So she reached out to us, and thankfully we were able to make that possible for her. She really was trying her best to take good care of them, and so that we really appreciate. They're really sweet and everything, so we're kind of excited to intake them, know that they're safe, and now that she can get out of her situation as well. So overall, it's a great thing that we were able to do today.
The lady that I went to pick these horses up from, she had a fence, and it was no taller than probably this right here, made out of sticks that she just must have found in her yard and just made a big pasture for them. One at a time. Hey, Zeus.
Hey, Zeus.
Nobody wants you in there.
Go.
Back up, buddy.
No. No, easy muley.
Hey, Zeus. I know that's your girlfriend, apparently,
muley.
supposedly. I don't really know. It's just what I was told.
Muley. So we got a lot more surrenders today, so we are getting ready to intake them, give them dewormer, probiotics, electrolytes, vaccines, get them ready. What do you think, Muley?
There is no snacks here. None.
There are no snacks to be found. Oh, okay, you need that.
Wow.
You want me to hold? No? Okay, cool. Great talk. We're here. I'm here.
I will in a minute.
I'm here for you. I'm just holding.
Scanner? Where's the scanner? Muley, you're cute.
She's really not that bad.
Yeah. Look at your little feet. They're so perfect.
Oh, look at these little square teethers.
We have little square teethers too.
They're young and
Yeah, I would
healthy.
say that's probably like 6 or 7.
Hi. We never get good donkeys and mules. Somebody better snatch them up quick because they're gonna go quick.
Their teeth look the exact same. Yeah, I would say like 6 or 7.
I'm just joining in with everybody else.
Oh, this one is mouthy for treats. She did say that. Could you tell? I could tell. Yeah. Okay. No. Yeah. He said that was not what I thought I was getting out of that deal. Good job. I like him.
He's ready. He's ready for his photo op.
It stands for to pick up its feet.
What about a back leg?
This doesn't happen ever.
Don't speak too soon.
It's a Christmas miracle, Jesus. A well-behaved donkey. Love it. What about you, Muley?
This is the OG. This is the OG donkey.
This is. Oh my gosh, and a mule that lifts its feet. That has never happened. I have never seen that happen here.
Okay, back leg. Hold on. Here it comes. Well, bam.
Don't lean against me. You're heavier than I am.
Oh my gosh. Wow.
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 Wow. Look at those little teeth.
Yeah, I would literally call all of these 6. Yeah. They really do look like they're 6 or 7. Maybe 7 on the high end because they're starting to get that little hook back there, but.
Yeah, but nothing major. Yummy, yummy, yummy.
Ah, it's so gross. Yeah, I need your whole nose. Thank you.
Say, I'm so good. This is Rain. Black Rain. I'm just kidding, it's just Rain. But she's a good girl. She did great. I don't know if she's over 20.
I mean, if the lady said she was 22, then I would just go with that because she's a purebred walker.
We're gonna go put these out in the pasture and let them relax and enjoy life.
So we finished intaking the surrenders today. That went amazing and super smooth, which was shocking. But they are doing great. We got them out in the pasture, gave them fresh hay, and they all came running. So that was really sweet. And now we're getting ready to go do the records.
Earlier this year, I was assaulted, and it did happen at a church social event. And somebody that brought a horse to us, and they wanted it euthanized. They said, my wish is that this horse is euthanized, and our vet couldn't find anything wrong with it. And we didn't euthanize the horse. They got pretty upset. They started coming to our church, and they ended up being at a church social. And he came over and ended up hitting me and hitting the phone out of my hand. And he hit my hand pretty hard. It actually hurt for quite a while. And it was a very stressful situation, but there was a court date, and Dawn did go there, and our church did take measures to make sure I felt safe at church. So just very thankful that this whole situation wasn't worse, and I'm glad that Dawn was able to go, and here's Dawn's report of being at that court hearing.
In the fall, Tanya was assaulted. I had gone to the court hearing here in Lewis County to see what the outcome of it was, so Tawny didn't have to go. He did plead guilty. Judge asked him if he did assault Tawny. He did say yes. I hit his phone out of her hand. Judge asked if the phone was damaged, and he said, not to his knowledge, he didn't know if her phone was damaged. He had told the judge that he had hit it out of her hand because she was filming him. The judge did say if it was a public space and there was no sign saying no filming, she had every right to film the incident. He was given a suspended sentence for 6 months. He cannot get in any trouble, traffic ticket, any kind of problems with the law, and he can have absolutely no contact with Tawny until June 9th of 2023. We're hoping that this is ended this situation and that there's no more problems with Horse Plus in this subject. We hope everyone can just move on from here.